Hi guys, my name is Gigi and I'm in an accelerated nursing school program and I just finished my first semester, so I felt like now would be a good time to kind of just share some things that I wish I knew before I started nursing school, because I just remember being like really nervous and I would always watch YouTubers talk about their journey, and I felt like it really helped me just prepare for what I was getting myself into, I guess. So just to start off, the first thing is that confidence will come with time. Like if you haven't worked as a CNA and you don't have that much exposure in the medical field, like that's okay, and it's okay to not know what you're doing. Like that's why you're going to school. I think it's just like really important for people to hear that, especially if you're going to nursing school and you have a fear of blood or a fear of vomit. Like it's a lot about exposure therapy. Like you get used to seeing those things and like you get used to being in that type of setting. Like I didn't really like blood. I started to just try to do like exposure therapy on my own. Like I literally would watch like YouTube videos. If I was getting my blood drawn, I would just like try to watch the phlebotomist do it just so that I could prepare myself. And over time, like you really do get used to those things and it starts to be so much less intimidating because you've seen it before. I just think that's really important for people to hear. It's not going to be as scary if you expose yourself to it multiple times. Like of course the first time you're seeing that, it's going to be weird because we're not used to just like seeing blood on a day-to-day basis, or vomit or feces or whatever it is, but you get used to it over time and your skills will evolve over time. Like I just finished skills lab and it's so crazy to think that like literally 8 weeks ago I didn't know how to insert like an NG tube or do a Foley catheter, like any of the skills that I learned. Now I have those skills, and honestly it really has given me so much confidence in nursing and outside of nursing. Like I feel like it's really given me a lot of confidence to try new things and not be scared. If I can go to nursing school and I can learn these crazy clinical skills, I could do anything. So like how could I ever feel ready? Like how could I step foot in a hospital? But it's like because you learn. School is supposed to set you up for success, and it really does. Like nursing school is very tough, but it sets you up to be a good nurse as long as you go to a good school. But that understanding and remembering that you can do it, and as long as you're committed, that confidence will come. Not saying that it's gonna happen overnight, but I do think that it's really important to just like celebrate the small wins and like look back and really realize like how much you have grown in such a short amount of time too. Like being in an accelerated program, you literally have to learn how to swim from day one. Like you get thrown in, like there's no dilly-dallying. You have to know what you're doing pretty fast, but it's good because you learn. And the second thing is kind of more negative, but nursing school, at least the school that I go to, and I think it's like this for a lot of schools, it's really easy to get kicked out of, which like it sucks and it's really scary. And I feel like all my anxiety from school really has stemmed from that, and it's just sad to say, but like certain people struggle with exams. Like we have to get a 75 or above to pass our exams. So like the second you're under a 75, like you're panicking, you know. In skills lab, we could only repeat the skill 3 times, and then on the third try, like you're out of the program, which is just so scary. I literally couldn't sleep the night before skills lab when we had to demonstrate a skill, because I would just always have the worst thoughts, like what happens if I don't get it this time, and then what happens if I don't get it the next time. But at the same time, like I was saying before, like the confidence does come with time. Like the first skills check off like was the worst, and then over time I felt like I had a lot less anxiety. The entire skills lab, I only had to repeat a skill 1 time, and then I passed it on the second try. It was like pretty much the scenario for most people in my program. If you put in the work and the time and you go to open lab and you practice your skills, you will feel confident when you're doing your checkoff, but you do have to put in the time. My program only like required us to do 1 hour of open lab a week before our checkoff, but I was there like sometimes 4 hours a week before the checkoff, and it does become a lot, but it's like I rather just put in the work now and be able to stay in my program and not fail a skills checkoff than just not go to open lab. Like, oh, the dimensional analysis test too, which we haven't actually done one of those yet. We learned dimensional analysis the second day of school, and every pharm test we had dimensional analysis on our exam, but starting next semester is when we have the test where you have to get like 100%. I don't even know how many tries you get. Maybe you get 3. I've been trying not to think about it because I'm honestly scared for that, but I know that that's going to be so anxiety invoking as well, because there's just so many like things that happen in nursing school where it's like you can get kicked out for that, you can get kicked out for that. Sometimes I kind of regret doing an accelerated program only for the reason that I'm taking out loans, and I think that really that's the case for most people in an accelerated program. Most people aren't paying for it out of pocket, but there's a huge difference between going to a community college and paying for that out of pocket and then failing out of the program, and versus going to an accelerated program and then failing out of that. It's just like a lot of loans that you are responsible for paying back. So if you don't make it to the end of the program like that, it just creates like another issue of not having a nurse's salary but still having to pay back those loans. So I think it's really important to consider that if you do want to do an accelerated program and you're going to be taking out loans. Like, a lot of my stress has literally just been, I need to stay in the program, and I didn't really realize that before I started. Like, there's so much stress around getting into the program, like that was already enough, and I thought that that was going to be kind of over once I was in it. Like, I knew the program was going to be hard, but I didn't realize like how much people struggle just to stay in the program, if that makes sense. But it is an extra motivator for me. Like, that's why I have been working so hard. Like, I feel like I'm really locked in with nursing school because I don't want to have to repeat any classes, and I want to be able to stay in my program because of the financial aspect. So, I mean, I don't know if I would be taking it less seriously. If the tuition was less, I'd probably be taking it the same amount of serious, but like, it's just an extra motivator to not fail out in my program. So I study hard and I practice skills hard and I do everything that I need to do to make sure that I'm prepared. And I think that that's really important too. You really have to lock in with nursing school, and I know that you guys have probably heard that before, but if you work this hard to get into the program, getting into nursing school is not easy. So if you got into nursing school, you probably want to stay in your program. So it's like, it's such a temporary sacrifice. I mean, that is like a benefit of being in an accelerated program. Like, I could really see the finish line whenever I just start to kind of get like upset because I don't have that much of a life outside of school. I just remind myself that it's such a temporary sacrifice. Like, I'm working really, 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 really hard right now, but it's just for 15 months. Like, that's gonna go by so fast. I'll have such a better quality of life being a nurse, and I know that it's gonna give me so much. So it's just like, I know that it's really hard to sacrifice as much as you have to sacrifice in nursing school, and a lot of people really do struggle with that, but it's so temporary. Like, I remember they even told us at our orientation, there's like another reason you can get kicked out or like delayed in the program is if you get injured or like really sick. You can't go to clinicals, obviously, like if you're very injured. So I remember they just told us at our orientation, for the next 15 months, like, you guys are ours, and basically, like, don't do anything that is gonna get you injured or anything of that matter. Like, if you break bones or whatever it may be, I mean, things happen, of course, but then it just delays your graduation time because you're not able to go to clinicals if you're in a cast or whatever it may be. So yeah, I remember like the day after orientation, I went to the beach with my sister, and the waves were pretty big, and anyways, we ended up going in the water, and I literally was getting pounded by the waves. Like, I felt like my neck was gonna snap, and obviously that's scary as it is, but I literally got out of the water so fast because I was like, I cannot get injured. Like, I literally just started nursing school yesterday. But yeah, I feel like I've just been trying to be like really careful in that regard, and also too, just getting sick, like, it can really set you back if you have to miss school. Like, I think we can only miss one clinical day, like, per rotation, but even for exams, it literally does not matter why you miss your exam. You could be getting surgery in the hospital, like, somebody could have died, it could be your best friend's wedding. Like, it does not matter why you miss an exam. You get a 10% deduction, and like, maybe that doesn't sound that bad, but it makes such a difference. Like, let's say you go into the exam and you get an 85, which is a great exam score, then your exam score is already a 75, and that's barely passing. So that 10% is huge, and like, it's just so important to stay well when you're in the program. I'm pretty much like always on top of my health, but like I take so many vitamins. I literally will go get IVs. Like the second I start to feel off or like I'm getting sick, like I'll go get an IV because I cannot afford to get sick. So I think that's really important to keep in mind, like just doing whatever you can to stay well, because that's gonna make your life easier when you're in school too. So it's just worth it to try to keep your health in good condition. But anyways, okay, so moving on to something a little bit more positive. So you might have heard this before too, like I don't really think that the content in nursing school is hard. Nursing school is hard, I will tell you that. Like I think that there's a lot of creators and people recently just saying like unpopular take, nursing school isn't hard, but I think nursing school is hard. But it's not the content that's actually hard. Like nursing school prereqs are a lot harder than actual nursing school content, in my opinion. That's different for everyone. I don't want to invalidate anyone's experience if they have struggled with actual nursing school coursework, but personally I struggled a lot more in prereqs. I thought chemistry was so hard. I haven't taken any classes like that at all compared to how hard chemistry was. So it's not the actual content that's hard, it's the lifestyle that's hard. Kind of what I was saying, you pretty much have to sacrifice everything to just give your life up to this program, especially in an accelerated program. But the hardest thing about nursing school is time management and stress management. Like if you are a good time manager or you're good with stress management, like I think that you are good to go to nursing school. Like you don't have to be the smartest person in the world to get through the nursing school classes, but you have to be organized, you have to know how to manage your time, and you have to know how to manage your stress, because it's a lot, especially in an accelerated program. It's a lot in a short amount of time, and your well-being can definitely get thrown off for that reason, and it can feel really hard just to keep up with what's going on if you don't manage your time correctly. I definitely think that whatever it takes to stay organized, like getting a super cute planner, like getting the iPad and being an iPad girly with that type of planner, like whatever it takes, I think that is really important for your success. But like I was saying, the content in nursing school isn't hard, but it's not just memorization. Like your study habits definitely need to evolve, probably from if you have a different degree or high school or whatever. I don't know. I used to study just flashcards and Quizlet. Like that's how I studied in undergrad. That was just, and I always did well, but in nursing school it's just different, and people always say that. And I remember before I started, I was like, well, what do you mean? Like, how am I supposed to study then? Like, everyone says it's different, but how is it actually different? It's because you have to actually apply the knowledge. The nursing school questions like aren't just gonna say like, oh, what is hepatitis or what is COPD? Like it's gonna give you a scenario, and then you have to apply the knowledge that you know about hepatitis or COPD, and then you have to answer a question. And a lot of it is just like how to be a safe nurse. So I want to make like an entire other video on that, just like how to answer NCLEX style questions. But that being said, personally, like the most helpful way or like successful way that I study is about doing so many practice questions. And especially in like the age that we live today, we're so lucky because we have ChatGPT. And I know that that's controversial, but my pharm professor literally had us do an assignment on ChatGPT, like showing us how we can use ChatGPT to help us create practice tests, because you can literally ask ChatGPT to create you NCLEX style questions. And so I will sometimes literally just upload my PowerPoint directly to ChatGPT and quiz me on with NCLEX style questions, if that makes sense. And it's honestly a game changer. But I think that personally that is the best way to study. Like obviously you have to have knowledge of the material before you just start quizzing yourself, but it's so much about application. Basically you have to apply critical thinking consistently. It's not about memorizing lab values or medication names, but like you have to understand why things happen, if that makes sense. That being said, another really good way to study is with study groups, because you can kind of talk out the content and the material, and I think that helps gain a better understanding of it. Because if you can talk through a topic and actually explain it to one of your friends doing the teach back method, I think that you actually know the material and you can actually apply it. Yeah, those are some things that I wish I knew before I started nursing school. If you like this video, subscribe. I definitely want to put more videos out, and I'm going to start also doing a lot of educational content because I'm a super big visual learner and I watch so many YouTube videos on topics in nursing school, so I think it really helps. But thanks for watching. Okay, see you next time.